While in the district, more doses of the monkeypox vaccine are now available through DC Health.
It comes as health officials shift focus on distribution efforts. Fox 5's Maureen Ume is live in Northwest this morning with the details. Maureen, good morning.
Hey, good morning to you guys. The priority right now is getting the vaccine into the arms of high-risk individuals. So DC Health revising their policy. The second dose will only be given to those with weakened immune systems, those who have cancer, HIV, that sort of thing. This revision of policy is due to a shortage of the vaccine, and so DC Health officials wanting folks to know it's not that they're not giving the vaccine, they just want to prioritize those in the high-risk category. Of course, those in the high-risk category defined as those who have had sex with men, trans-loving men, also bisexual men, people who work in environments where sexual activity is happening. As you know, this is a very contagious disease. Health officials say their new single-dose strategy is consistent with monkeypox vaccine distribution strategies in places like New York City, Canada, and the UK. Studies have shown that the monkeypox vaccine is effective for at least 6 months after the first dose. Currently, there are 162 cases of monkeypox in the district, including an infant, and this represents the highest number of cases per capita in the U.S. Again, because this is a disease that is classified among gay, bisexual, trans-loving men. There is a stigma associated with this. Health officials are saying they're trying to lift that stigma because at the bottom line is everyone really is at risk.
Very clear at this point that the community most affected is the LGBTQ community. This is one of the reasons why I said we've been deeply engaged with them, both to share information, also to learn more, make sure that everybody's communicating in a way that's both scientifically accurate and respectful. Obviously, it's really important that we do not use this moment to propagate homophobic or transphobic messaging, and I think it's really important that we stick to the science, stick to the evidence, and do it in a way that's respectful of people.
The World Health Organization has declared this monkeypox a global health emergency. Right now, there are more than 16,000 cases in 75 countries. 45 states here in the U.S. have also cases. As I said, 172 cases here in D.C., but those numbers are quickly rising. Health officials really wanting to get at least one dose into the arms of these high-risk individuals before this spreads to the communities outside what we normally see as the norm. Back to you.
All right, Maureen, thank you very much. In the district this morning. In Montgomery County, health officials are working to track cases of monkeypox through contact tracing, similar to what they've done with COVID. Also plans to expand the county's vaccination program as soon as possible. Officials say the county is working on a pre-registration screening form, also similar to what they did with COVID. The goal is to identify at-risk individuals, and then as they get more vaccines, they'll be able to contact them from that list. Our Instant Poll question this morning is dealing with monkeypox, and the question is, does the spike in cases make you want to get the vaccine? Overwhelmingly, you are saying no. More than 90% of you, as a matter of fact, saying no. You can cast your vote on our website at fox5dc.com or on our free Fox 5 app. Holly?